Greetings, friends and followers. This is Nurses Talking. I am Jill Barcy. As always, if you like what you see and hear, subscribe, leave a comment. We'd love to know what you think. So here on Nurses Talking, we speak to nurses anywhere in the world at any stage in their nursing journey, from students through retirees and everywhere in between. And today, I am very pleased to welcome Dr. Peggy Berry. And Dr. Berry is a registered nurse. She's an environmental activist. She's the executive director at Between the Waters, and she's CEO of Thrive at Life Working Solutions. So welcome, Dr. Berry.
Thank you. And another thing to add to that is that I'm the Chief Learning Officer for Ergonauts LLC.
Oh, okay. So we'll have
That's not, but I thought I would put that on there as another one of my jobs that I do. I'm also executive director of the Ohio Association of Occupational Health Nurses, and we're having a 2-day state conference beginning tomorrow in Hamilton. Okay. So see, I couldn't do Thursday or Friday because I'm actually presenting on Friday with my co-worker Steve Davis on lean ergonomics. So I get into all sorts of stuff.
So isn't that what nurses do?
Busy.
Isn't that what nurses do? We have to put our noses in everything.
I know, or at least our fingers.
Our fingers, dripping. Yeah. Yes, indeed. Yes, indeed. Yes, indeed. So let's start with the simple thing of why you became a nurse, though.
Why I became a nurse? Well, this is going to age me, but back in 1972, there wasn't very many occupations at that time for females. You could be a secretary, you could be a nurse, you could be a teacher, you could not much of anything. That was about it. Those were our choices way back then. But I found that I gravitated towards healthcare for two reasons. One was when I was 16 years old, and I was walking to my job as a busgirl at a pancake house. A man keeled over and died right next to me at Steak and Shake when I went in to get a soda before I continued my walk on. And the restaurant personnel apologized to me for that happening. And this was before CPR or anything like that. You know, when you died, you died. There wasn't anything else we could do. But another thing was I injured my knee and had to have surgery when I was 18. And after being cared for, I decided that I would go to nursing school. I will tell you that I failed the first 3 months because it was a diploma school, and I was kind of like a hippie. I didn't do well with all the regulations and rules, but I went on and did a bachelor's, and I thrived. Hence Thrive at Life. I thrived in that environment, and after so many years, I went back for my master's and then my PhD. And I'm still a little off to the left a little because I didn't go into teaching. I didn't go into a facility. I worked for Wright Pat Air Force Base for a year as a consultant. And then I moved into just sticking my fingers into a lot of pots after many, many years of working as a traditional nurse in a hospital, then in occupational health and case management, and then doing my master's and PhD.
That's awesome. And don't worry about it aging you. I'm right there with you. I became a registered nurse in 1974, so I get what you're saying.
Yeah. Good. But the thing is, we should never limit ourselves as far as if you have an RN behind your name, it doesn't matter if you're in a healthcare facility or if you're working as an occupational health nurse, or you've segued into a different industry, as I have with my environmental activism and chief learning officer with Argonauts. I mean, it's how you decide to expand yourself.
Exactly, exactly. And I'm so happy you said that, because that's really one of the goals of this whole platform, is that I really, really want nurses to see just where we are and just how far we can be and how influential we can be everywhere we go. So I'm so happy that you said that. Because, you know, many nurses come out of nursing school or in nursing school and they're told, well, you really need to get into med surg and you really need to do this. And you don't really.
You only about, if I remember the stats right, only 65% of the graduating nurses go into healthcare or hospital facilities. The rest will go into nursing homes or public health or home care. You know, there's only so much in terms of positions available. And like I said, you have that pearl in that oyster with your nursing degree. And if you, some people will start with the diploma, go to the associates, go to the bachelor's, and go to the master's and the PhD. It's just like a progression. And they find what they love. Inside of nursing, because I went from cardiac step down to neuro to orthopedic to home health to nursing home, and then to case management, and then segued right into occupational health nursing, which is really my love. It's like being a community health nurse for a population that comes to you every day, and you can help them with your health behaviors and treat them for work injury or illnesses that occur at work. It's great.
Awesome, 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 awesome. So you talked about your activism, environmental activism. What form does that take?
Okay, well, one is I participate in something called tackling the A to Z's of plastic and fossil fuels. We are on Facebook. We have an entity there as well as Twitter. In fact, I think I have a 6,000 person reach on Twitter.
Okay.
The personal one, A to Z Plastics, and Between the Waters. And every other month, we put out a Zoom for an hour, hour and a half. Last month, was it last month already? Oh my gosh. It was on the health effects of fracking and the oil and gas industry.
Okay.
A couple months previous to that, we did it on the false narratives of the hydrogen hub for the Ohio River Valley. They think it's the panacea to carbon capture and make hydrogen. And the fossil fuel industry is really interested in that. And then we look at what happens with that plastic. We even had a speaker from Indonesia talk about the plastic that ends up in their country, and they are just swallowed up by it. So all of these are available on Halt the Harm. And we collaborate with Halt the Harm, Sierra Club, Ohio, the Indigenous Environmental Network and Climate Reality, and again, Between the Waters. And I have a grant to continue to do that programming until that grant runs out, and just do education on all of this. You know, when I went into nursing, I was told that it was all the person's health behaviors that affect their health. And then there was something called social determinants of health, where you live decides how your health outcomes are going to be. But the other side of that is, do you live downwind from a coal-fired power plant? The particulate, I don't care what they do to filter it, the particulate, the pollution, the stuff that seeps into the ground when coal sits stagnant until they use it, causes a massive amount of health
issues.
problems. Yes. And now we look at PFAS, thanks to DuPont and their wonderful way of putting out Teflon and putting it in the Ohio River. We have 99% of the world population has been contaminated with PFAS. And that's perfluora. It's a fluoride carbon chemical that is so durable. It will take centuries for it to break down. And it's now even in our rainwater from it evaporating into our clouds. And that causes obesity, hyperlipidemia, some cancers, thyroid issues. And I'm surprised we don't all make DuPont pay for our Lipitor. You know, so it's not all our health behaviors. If only 35% of our lung cancers are caused by cigarette smoking, where's that other 65%? It's the environment. And it's what we do and where we put our factories, how what is a good word? How they do not or do pollute the water systems. And oil and gas are poor players as well as DuPont, you know, as well as DuPont. So chemical safety is so important, and preventing pollution is so important. So vote. If we put this out before November, 8th? 8th. Vote. Make sure you get out there and you vote for environmentally friendly legislators. So indeed. We don't have that. They're just going to be bought off by the highest bidder. Exactly. So anyway, that's why and really it was in 2012 when I went to Washington, D.C. to talk about clean air for kids, okay, for everybody, that my own congressman, who was behind closed doors in his office after I had made an appointment to speak with him with a group of people, sent out a legislative aide who probably just gives coffee, you know. And I gave him my 5-minute elevator speech. We started to walk away, and that congressman, Mike Turner of Ohio, came out of his office, walked past us, and it was like, don't you know I am your constituent? I made an appointment with you, and I tried to talk to him about that, and he blew me off. Worst thing you can do is blow off a nurse. Okay. I was so angry when my husband picked me up. We went to a restaurant where there was a fundraiser for Mike Turner. Okay. And I went into that back room, and I'm 5'3" of nothing, okay? And I was speaking to 6'4" attorneys fundraising for Mike Turner, and I told them why I would never vote for him again. Okay. And because I was so angry, and I wasn't sure if it was how I presented, I also joined the League of Women Voters, so I would learn how to address issues effectively, and that just kept on snowballing to where I am now. Getting angry and calling people, don't listen to the nurse, don't listen to moms or grandmas, and say this is killing us. Okay, so there I am. You've gotten my elevator speech as to why I became an activist, because I became angry. And sometimes you need to get there, and sometimes you need to get there because, and maybe you should thank him, because had he not made you angry, you would not have been pushing this as hard as you are, perhaps. And you know, will eventually, hopefully, benefit a whole lot of people from that spark of anger that he created. So And honestly, we're getting ready to put up all of the YouTube videos that we have done for the last 2 years on plastics, what it does to us,
Yeah.
what the nurdles are going to do as they come down the river, and the fact that we tend to eat a credit card a week in plastic.
In plastic, yeah. Can you imagine? Can you imagine? Well, yes, you can. Yes, you know.
Yes, I
But
can.
yeah, but you know.
And then we're seeing a higher incidence of leukemia and bone cancer in around areas that have fracking wells. And that is directly because we found out that PFAS is in the fracking solution.
Mm-hmm.
And then the waste that comes up with the fracking, with the methane, is radioactive. And this stuff is then injected into wells throughout Pennsylvania, New York, Ohio, and it migrates into the water because this stuff fractures shale. That's how they get the gas.
That's how it happens, yeah.
This is why we have earthquakes. This is why we have cancers. This is why some people have to truck their water in because the wells have been tainted. So I'm just for renewable energy at this point in time.
Yeah, I get that. I absolutely I hear you there. And you know, we get blinded by the immediate money, I guess, of using fossil fuels. We don't want to we say we want to move on, but in fact, we don't really want to give it up because right now, you know.
I don't think people have been educated enough on the alternatives. But, you know, I like to show this. This is my silicone straw. Okay. I do not use plastic straws. Yes, I have a plastic container. You see, okay? I use that. I'm going to use that the rest of my life and maybe pass it on. But silicone straws, take that with you. Don't ask for straws in restaurants. If they try to offer it to you, tell them to take it back. When you go to Kroger's or you go to any kind of grocery store, take your bags with you or ask for paper bags. Let's decrease our individual plastic use so that they don't continue to make cracker plants to make the product for plastic. But, you know, healthcare itself is a real high end user of plastic syringe, plastic bags, whatever. I don't know about you, but
and the over packaging of a lot of stuff.
IV and glass containers.
Yes, I spoke about just the other day. Yeah.
You know, so if we can speak with our hospital facilities on halting the harm that they do themselves, you know, that's another way of doing it. So for any nurse who's listening to this program, talk to your hospital administrators about how they can be better environmentally with their community. Yeah. And there's a lot of resources for that too. Yeah.
And we have to personally walk the walk, really.
Yes.
Each one of us, we have to walk the walk.
Yes.
Because
and it's hard. It really is. You know, I myself, I'm a failure sometimes in that. But I encourage myself daily to do right.
Yeah. And as they say, when you know better, do better.
Yes, definitely.
Yeah. And no one said that doing better was going to be easy, though. But, you know, you got to do better.
Yeah.
All right. So we have gotten that out.
Sorry.
No, that was good. That's good. Because, you know, we often don't talk about those things. We talk about, a lot of the times, we end up dealing with the results of all of these actions, right? Healthcare basically is reactive. And we do need it to be proactive. And these are the kinds of things that go into having proactive healthcare or wellness care.
Yeah. I mean, it's like my daughter just texted me before I got on. She says, Mom, I just found out I have osteoporosis. It's mild, but I have osteoporosis. And this kid, she's 43. Okay. She's not a kid anymore. She runs, she lifts weights, she does a lot of weight bearing exercises.
Mhm.
But, you know, with the injury, sometimes osteoporosis occurs. And
Yeah.
we can't all blame that on health behaviors because she's really been mindful of her health.
Yeah.
So,
Yeah. Yeah.
we have to stop blaming the patient,
Indeed.
okay, and look into what surrounds the patient. For years, nobody asked the question when they came in ill, what do you do for a living?
Hmm.
Okay.
Yeah.
Are you a welder? Okay, that's the reason why you've got
Yeah.
this going on.
Mhm.
Or
Yeah.
worked in a nickel plant and they were having skin irritation. Well, that's an occupational illness, and
Hmm.
they can no longer work with nickel because they're allergic to it now. So, or gloves.
Yeah.
How
Yeah.
many of
There was
us
this,
have
remember, Brent,
acquired latex
exactly.
allergies?
Right.
Okay. And then found that you can't even walk past a box of gloves without going into anaphylactic
And
shock.
there you go. Hmm.
Okay.
Yeah.
It's the environment. It's not
Yeah.
well, okay. Sometimes there are health behaviors involved.
Yeah.
You drink too much, you smoke too much, you don't eat the right foods, you love to eat potato chips every night and you go through a bag. Those are health behaviors you need to look at.
Yeah.
But you also need to look at the social determinants of health
Of
also.
course. Of course. Yeah. Even, the how you travel to work, even just your route to work, at times can be a detriment. So, yeah.
Oh my God, Cincinnati traffic on I-75 is, I was pulling my hair out for the 6 years I was doing my master's and my PhD. It was horrible, but I made that through it.
There you go. There you go. There you go. So, having been a nurse and worked in institutions and outside of institutions and whatever, I've been asking people, are there any aspects of nursing life per se you'd like to see change?
Well, okay. Um, I'm actually working on an article about nurse suicide, and I will be speaking about that at a national conference in March.
Hmm.
Well as revisiting workplace bullying, which was my dissertation was on how workplace bullying affects productivity and well-being in novice nurses. Okay. Um, I also read an American Hospital Association report that talked about resiliency training, this training, and then they talked about the problems within the hospital
Hmm.
environment itself. Um, this is personally my opinion. I don't think we need to do 12-hour shifts 7 days a week. And in Ohio, we've had mandatory overtime, especially during COVID.
Hmm.
It is untenable and unsustainable.
Hmm.
And it doesn't matter what industry you're in, you could be an automotive bit piece
Yeah.
manufacturing. You should not be working people 12 hours a day, 7 days a
Seven
week.
days a week.
It's not good for them.
Mhm.
Even if they say, well, you're only going to work 3 12s and then you're off a couple of days, schedules get screwy. Hire more people and go down to 8 hours a
8 hours.
day,
Hmm.
5 days a week. Give them a schedule that they can plan on because it helps with their work-life balance. Let's just say life work balance, and teach nurses and nursing students to consider life balance first and
Hmm.
foremost
Hmm.
before work balance,
Hmm.
because the two don't work, especially with females. And we are still primarily a female work environment in healthcare.
Yeah.
And we have been all of our lives taught to blame ourselves.
Yeah.
Things, and we need to stop doing that because it's not always our fault.
Yeah.
Mostly it isn't our fault. It's
Yeah.
systems issue with healthcare. So if something happens at work, do a quality improvement program within the hospital to improve the system. If medications are late, it's not because you purposefully didn't give them out on time. It's because the pills weren't there. You had too many patients. I'm sorry, I'm going to get on my soapbox with this.
That's okay.
Healthcare itself needs to start to look at how they treat their employees, how to make it more balanced inside and outside of work. And if they keep blaming the community for people to be ill, then they need to look within the community on how to improve it. Right now, I'm involved with a group called Musketeers out of Cincinnati, okay, who are working to eliminate violence in and around the neighborhoods. They figure it's a virus and it needs to somehow be cured. You know, it's a generational thing. We have been educating people to kill each other, okay, to do it via violence instead of how to speak with each other. We're being more polarized, but the other side of it is we're being poisoned too, chemically, by lead, by PFAS, you know. So we have to find a way to create better environments outside of work, meaning that work shouldn't pollute the community around them if they want to have good workers.
Yeah.
That was kind of circular, wasn't it? But
you got there. I got there.
You know, we have to do better. Hospitals and nursing homes need to do better in terms of creating a better work environment inside their facilities and then being accountable to the communities around them by not polluting. And that is change out whatever plastic you can that's within your facility. Syringes, man, don't you remember those little, as a matter of fact, I brought one home with me to keep it. I should dig it out. It's a metal where you put the glass capsule in, break it.
Yes, the little ampoule.
Yeah, the ampoule. Do it that way. Stop with the syringes, the plastic syringes. You need to move away from those as much as possible.
Yeah. And you see, and these are the things that that impressed me, because I think more and more as I speak to more and more nurses, as more and more nurses pursue more and more wider education, I'm beginning to see that we're kind of coalescing around taking care, demanding things that take care of us. It's very slow. It's a very small nugget, but I am beginning to see it happen. And once we start saying, listen, what you're doing, the environment we're working in, all of this is not acceptable. We demand such and such. I'm hoping it will spread.
I hope so, because if we don't take care of ourselves first, we can't take care of our families or our patients.
Exactly.
Therefore, take care of yourself first, nurses.
Yeah.
Address workplace bullying in your workplace. Have a better system of doing that. Have a better system of changing your workplace. Ask for, if you need to, demand 8-hour, 40-hour weeks and enough staff to be able to staff that 24-hour a day, 7-day-a-week operation. And an understanding that you are the caregiver for your family. Don't feel guilty when you have to call off work because your kids are ill.
Exactly.
You know, I, God rest his soul, my former husband, the father of my children, his thing was, I make more money than you, you're staying home with the kids. I had no help at home. And about 35% of those females that are working in the hospitals have been in an abusive relationship. So hospital administrators need to be aware that some of those nurses don't have the help.
Mm-hmm.
And I had some HR person say, well, you have to figure out who your caregivers are going to be when you have to come into work. And I'm going, you know what?
That's me.
That's me.
That's me.
I didn't have grandparents. I didn't have friends. I had moved from San Antonio to Dayton, Ohio. And even now I think, okay, this is why I believe in a self-employment for me, because of my age,
Mm-hmm.
my husband's health, my health, because I have a fusion and I have 2 knee replacements. So I can take care of me first so that I can reach out and take care of my community and keep working the way I do in my environmental activism. That's what I try to do.
Yeah.
Not always good at it because I got sick going to Maui. What can I say?
And you know, taking care of ourselves honestly, as women and as nurses requires unlearning some things, because as women we grew up as women thinking that we had to be last. We had to be, women were naturally nurturers, and we think we forget about nurturing ourselves. We have to nurture everybody else. And then it's reinforced in nursing school. You have to nurture everybody else. And nobody speaks about where are you in this equation?
Right.
So we have to unlearn these things sometimes and understand that we got to take care of us.
And there are things that we need to do that make us feel good.
Indeed.
Okay. I'm not saying an ice cream, chocolate chip, cherry ice cream cone with a waffle cone with 2 scoops, which is over 1,200 calories. Okay, so sometimes I do indulge in that. Okay, not frequently, but that is, if you really want to have that lipstick, buy the lipstick. I like to have lipstick on. If you see something in the window and you can afford it, buy it for yourself. Don't say, okay, I'm gonna save that up for a rainy day, because then you're dead and you didn't get what you needed to feel good about yourself. I like to have my hair nice, but I stopped dyeing it a long time ago. It was it's a pain in the butt. So I just let it go natural now, and
I get that.
yeah, you get that. I
get
get that. And you know, you don't have to be perfect. Just be comfortable.
Yeah. Yeah.
Just be comfortable.
Yeah.
And that's what I try to do for me. Sometimes it's locking my door so that my cat doesn't come in. Or my husband, which I have a problem with sometimes. You know, it's finding your safe place in your house too, where you can just read a book.
Yeah. And knowing what works for you.
Yeah.
Dr. Peggy,
yes,
thank you so much for this.
Well,
it has been such an enlightening conversation. Thank you so very, very much.
I hope it's been fun too.
It has been fun. It has been fun. Absolutely, it has been fun. Well, thank you.
All right.